Hi, my name is Catherine Mosen. I'm the Vascular Access Nursing Advisor for the adult sites. Today I'm going to be showing you how to put in an IV using an aseptic non-touch technique. To figure out which catheter size you need and which vein is the best for the IV insertion, please refer to the protocol. So keep in mind that any type of vascular access needs to be reassessed on a daily basis, and that a peripheral IV is not used for 24 hours. It needs to be removed. And lastly, don't forget to document your insertion procedure, as well as the reason for the removal of the IV. Before starting the procedure, perform your hand hygiene and double identification as per MUHC policies. Explain the procedure to the patient and caregiver if present. Prepare your work surface and equipment. In order to remove the air bubble in your syringe, before removing the cap, press on the plunger to loosen it. This technique avoids pulling air into the syringe. Prime your needleless connector. Open your other items and break the seal between the catheter and the needle by creating a small window. Make sure to return the needle to its original position, otherwise you will be trying to puncture the skin with the catheter. Apply the tourniquet and select an appropriate vein as per the recommendations in the protocol. Once you've chosen a vein, remove the tourniquet while you disinfect the skin. Don non-sterile gloves. Ideally, use a chlorhexidine gluconate and alcohol swab or a swab stick to disinfect the skin. If the patient has an allergy to chlorhexidine, use alcohol alone. Disinfect using a back and forth motion, 15 seconds in one direction and 15 seconds in the other. Reapply the tourniquet. Stabilize the vein distally to the puncture site. Keeping the bevel up, puncture the skin at an angle of about 30 degrees. Once you get a flashback of blood, lower the angle until you are almost parallel to the vein and advance the catheter an additional 2 millimeters. This ensures that the catheter has also entered the vein. Use your index finger or your second hand to advance the catheter by advancing the gray part of the device. Keep the white part stable to avoid inadvertently pulling out the needle before the catheter is completely threaded. Only pull the needle out when the catheter is completely in. Apply the dressing over the insertion site and remove the needle. Apply pressure over the whole dressing surface. The heat from your hands will help the dressing adhere better. Once the whole extension has been primed with blood, clamp the tubing. Remove the plug holding the end of the catheter upright. This minimizes blood spilling. Attach the needleless connector, open the clamp, and flush using a stop-and-go technique. Clamp the tubing as you flush the last ml. Remember to always flush until the tubing is completely clear. This reduces the risk of occlusion. Apply the label with your initials and the date. Use the other piece to secure the extension.